I'm here with Dr. Quintana.
Hello.
As you know, I went through my whole holistic transformation and working on myself in 2013, and I started coming to him in 2014. And then at that point, I was getting treatments about twice a week.
Yes.
For many months, many months. And then slowly we progressed where I was only needing treatments maybe once a month. And then now I hardly ever come, but I really have to get back on my routine of coming on preventative and doing at least 4 treatments a year, which is what he was suggesting when we were talking earlier. My symptoms when I started coming to him, and I changed my diet and I changed my supplementation and started stretching and really focusing on my body more, I realized that I had to really focus on the right side, that I was misaligned on the right side, and I was having numbness and tingling from my neck all the way down to my toe on the right side. And I was very misaligned. I had to build my core. He gave me strengthening exercises and things that I really started to focus on and work on for a very long time, which I've kind of lost over these past few months, and I haven't been focusing on myself as much as I've been focusing on others. So that's my goal now, is to get realigned, readjusted, and back to where I can start working on stretching and focusing on those muscles that have weakened, since I haven't been focusing on them in a while. And I'm here because my neck is hurting on the left side and I can't turn my head towards the left. Usually that wasn't the pattern before. It used to be the right side. Now we're on the left side.
It's true. All right, so what we're going to do now is I'm going to have her lay face down, and first thing I'm going to do is evaluate the alignment of her spine. So I'm finding that the left leg appears to be short. That could be one of many things at this point. Let me have you lift up a little bit. So as I palpate and touch her pelvis and her spine, first thing that comes clear is that the left hip is significantly higher than the right. So there's a little bit of torquing going on here in the pelvis. And for her, having a little bit of disbalance in the pelvis has been pretty common for her. And this being the base of the spine, everything above it is going to have to compensate as a result of what's going on down below. So what I want to do is continue to palpate and find any part in her spine that is misaligned or just not moving or functioning the way it should. So she's got a lot of tight muscles in her neck and her upper back area, which again is very common when you have a symptom like pain or difficulty turning your head in any direction. I'm going to start off with a little bit of traction to her lower back, so I'm going to have this table move up and down. That will help me kind of gap the joints in the lower back, and then eventually I'm going to adjust and try to level the pelvis and then go about adjusting different areas of the spine that may need it. The machine is going to go up and down. So as the machine moves up and down, I'm using a massage and a traction as the machine goes down, I traction upwards in her spine. Again, trying to get a nice gentle stretch and separation or gapping in between the joints of the spine. The brain and nervous system, as the spinal cord runs down your spine, is encased completely by the spine. So the function of your nervous system relies very heavy on the function and alignment of your spine. So in order to eliminate symptoms, pain, or maybe some sort of radiculopathy like numbness, tingling, cramping that you may have from your neck that goes down into your arms, or from your lower back that goes down into your legs, if we can align things properly, very often that will take the pressure off some of the nerves and some of the pinching off that nerve, and that symptomatology goes away.
of the things that we did notice early on is if I got adjusted sideways, that my hips would actually pinch a nerve and my right leg would go numb. So we ended up focusing on just
A drop piece
adjusting it
technique.
this way.
Yeah, this is called a Thompson drop. Some people, when you have a rotational component to the lower back, it just seems to aggravate some people. For some people, it's the only way they can get better. But in this case, we found out real quickly that her body did not like that style of adjusting. So I'm going to go and use a different technique. Unfortunately, we are schooled in many different techniques. And my goal is, again, to get that hip to come back down by using this drop technique. And as usual, her body responds really, really well. That pelvis comes down real easy. Perfect. Now I've moved up here. So now what we're going to do, after we've adjusted her pelvis, is now move on up to the cervical spine of the neck. And the first thing I want to do is kind of palpate, which means just touch. Again, feeling for alignment and function, movement, what normal is. In her case, she doesn't have a very good cervical curve. It's too straight. We call it a military neck. Very often caused by sitting in front of a computer too long, looking down more, poor posture, all those sort of things. Mild curvatures in the spine, which Diane has had, a mild curve most of her life. So as I'm going up and down her spine, I'm finding that the muscles of her neck are very, very tight. And there's a couple of segments right here in what we call the suboccipital region, which is from the skull to the first two segments of her spine. These muscles are very tight, and these two first segments are not moving and are not aligned the way they should be. So what I'm going to do here is apply a chiropractic adjustment to those two segments. Nice and easy, relax. Now I'm going to go to the segment right below it. The way your head drop, nice and easy. Good. Relax. Perfect. You're good.
And I was telling him that I've been having symptoms early on in the week. I've been having headaches. I just didn't really pay attention to them for quite a while.
Very common symptom when something's not aligned properly in the cervical spine is to have headaches. All right, thank you.
Thank you.